Welcome to Manual Handling and Transportation Training. At the end of this training, participants will know the minimum health and safety precautions for manual lifting and handling operations. By the end of this course, manual handling, lifting and moving, risk factors, rules to follow, and correct manual handling methods will be covered. Manual handling includes lifting, lowering, pushing, pulling, carrying, or moving a load by one or more workers, involving risks particularly of injury to the back or spine due to the nature of the work or unsuitable ergonomic conditions. Good technique does not increase your lifting capacity. Regardless of capacity, it reduces the risk of accidents and injuries. Risk factors in manual handling can be categorized as load-related factors and individual risk factors. Risk increases if the load is very heavy or large, rough or hard to grasp, unstable, or has shifting contents. If the load must be held away from the body or requires bending or twisting, especially with dense, injurious shapes, there is a high risk of back and spinal injury. Very strenuous tasks, work done while bent or unstable, or sudden load movements increase back and spinal injury risk. Inadequate space or height, uneven or obstructed floors, or environments that prevent safe height and posture increase risk. Level changes, unstable standing areas, and poor temperature, humidity, or ventilation significantly raise back injury risk. Excessive frequency or duration, repeated twisting, insufficient rest, long carry distances, and non-adjustable work pace create back and lumbar risks. Unsuitable physical condition, inappropriate clothing or footwear, and lack of adequate information and training put employees at risk. Always consider appropriate lifting/transport equipment first. Even if you can carry it, prioritize mechanical aids to eliminate risk. If lifting and handling equipment is not available, assistance must be sought. The negative characteristics of the load can be reduced by using more than one person. Wrapping rough, heavy, large loads and carrying them at chest height will relieve the load on the waist. When transporting physically large loads, care must be taken not to obstruct the field of vision and the walking path. Care should be taken not to bend the waist when lifting loads from the ground, regardless of the conditions. The most correct way to lift a load from the ground is to squat down and lift the load using the strength of the legs. Plan where the load will be placed. Use suitable aids. Decide if help is needed. Remove obstacles. For long items, plan a halfway rest or change the carry method. Choose a stable, level surface. Set feet shoulder comfortable apart. If possible, point the rear foot in the direction of travel. For low lifts, bend knees, don't kneel fully. Keep your back straight, chin slightly tucked. Lean forward slightly. Keep shoulders level with hips. Hold the load so that it is within the boundary formed by your arms and legs. The best lifting position and type depend on the situation and personal preference. There's no fixed legal weight limit. Worker capacities vary. If any dimension exceeds 75 centimeters, injury risk is higher and one person is not appropriate. Loads greater than 75 centimeters with sharp edges, loose contents, or lacking grip points require gloves and extra care. Bulky loads restrict vision and raise slip, trip, fall risk. If the load is unbalanced, fluid, or likely to shift, it is difficult to estimate the force that will be applied during manual handling, and this uncertainty can cause the handler to be suddenly exposed to additional stress when they are not prepared. This situation usually occurs when there is no information about the characteristics of the load or when there are no warning signs on the load indicating its characteristics. In situations such as transporting a 20 kilograms part and securing it to the machine, the worker has to reach beyond the normal level of the machine and work in that position, causing the load to move away from the body and increasing pressure on the lower back and back. Remember that you lift objects with your brain, not your body. If you absolutely must lift a heavy load, concentrate very hard, as weightlifters do. Move slowly and cautiously when lifting, and avoid sudden movements. Do not put sudden strain on your muscles. Tense your abdominal muscles during lifting to work all muscle groups at the same time. Tensing your abdominal and back muscles supports your spine. When standing, do not bend over to pick something up from the floor by rotating your waist to the right or left. Do not put weight on your back when your waist is bent backward. If you must lift something, bend your knees slightly and lean forward slightly. If you need to carry any weight, distribute it symmetrically across your body before carrying it. Do not lift heavy loads higher than your waist. Trying to lift such loads above your head can be disastrous. When carrying an object, keep your feet firmly planted on the ground. The distance between your feet should be approximately shoulder width apart, and your toes should point outward. If you need to turn while carrying a load, turn your feet rather than your waist. Do not attempt to move a heavy object from one place to another by pulling or pushing it on your own. Keep the load as close to your body as possible. Keep the heaviest part of the load close to your body. If you cannot stand close to the load, slide it toward you before attempting to lift it. Do not bend your body when turning corners. Put the load down and adjust it. Put the load down first, then slide it into the desired position. Keep your back straight. Use leg muscles. Keep the load close. Keep elbows in. Grip with your palms. Keep feet apart. Plan the lift, determine placement, use aids, and assess whether assistance is required. Remove obstacles. For items longer than shoulder height, plan a halfway rest point or change the carry position. Keep feet apart on a stable, level surface. Place the rear foot toward the carry direction when possible. If you are lifting a load at a low height, bend your knees but do not kneel completely or bend your knees too much. Keep your back straight. Tucking your chin in can help maintain the natural curve of your back. Lean forward slightly to grasp the load, keeping your shoulders level. Hold the load so that your arms form a straight line with your shoulders. The best lifting position and method depend on the current situation and personal preference. When lifting a load, lift the load by keeping it close to your body and placing the weight on your legs. Keep your back, neck, head, and chin straight. If you need to turn while carrying a load, turn with your feet, not your waist. Put the load down first, then move it to the desired position. Remember to lift objects with your mind, not your body. If you must lift a heavy load, concentrate very well, as weightlifters do. When lifting, move slowly and carefully, avoiding sudden movements. Do not put sudden strain on your muscles. When lifting, tense your abdominal muscles and use all muscle groups at the same time. Tensing your abdominal and back muscles supports your spine. Do not twist your waist to the right or left while standing to pick something up from the ground. Pushing and pulling are actions performed by using one's own body weight. When pushing, you should lean forward, and when pulling, you should lean backward. To be able to lean forward or backward, you must ensure that you have sufficient grip on the surface you are pushing or pulling against. Avoid bending or arching your back. The objects you hold should have a handle or grip so that you can use your hands to apply force. Back pain affects most people, leading to lost workdays, medical visits, and surgeries. It is a major occupational health burden. The most common cause of back pain is excessive strain on the muscles and ligaments. If the strain is caused by bending forward without bending the knees, lifting heavy objects, carrying heavy loads, or twisting in inappropriate positions, it is even more serious. In muscle strain, pain is usually localized in the lower back, and movement of the lower back is restricted. Back pain can be prevented to a large extent through prevention. The longer you are away from work due to back pain, the more difficult it becomes to return to work. 95% of back pain is caused by strain in the back region and is referred to as mechanical back pain. The main diseases associated with mechanical back pain are as follows: muscle strain, injury, herniated discs, sciatica, osteoarthritis, postural abnormalities, spinal curvature. Only about 5% of back pain is caused by serious conditions such as inflammatory, infectious diseases, or cancer. Musculoskeletal disorders related to manual handling are particularly caused by the following conditions: manual transport of loads, lifting, holding, carrying, pulling, pushing, strenuous body positions, sitting,